hospice is, we talk about, being able to manage symptoms in kind of a variety of different environments. And that's definitely kind of, the clinical expertise for how hospice has been set up and what our caregivers are able to provide. We really do have the ability to step into even a very difficult home environment, provide just a wide variety of equipment support for patients. When you think about a patient that is in the hospital, kind of if you envision the equipment that is surrounding them in a hospital environment, we're able to duplicate those things at home. And so when you think about just the emotional benefit of being able to receive almost hospital-type care in your own home, where you're able to, see your friends, your families, your pets, those kinds of things. That's really a significant benefit of hospice. We are equipped to be able to help with just very, very complex situations at home. Obviously, our specialty is in, being able to treat pain, terminal respiratory distress, terminal nausea, vomiting, interventions for seizure activity or recurring fevers, that kind of a thing. That's really kind of at the core of the clinical capability of hospice. But we are equipped to be able to handle just very sophisticated drain mechanisms. Really, hospitals are able to take patients that really are receiving very acute care and kind of hand them to hospice and allow us to really step in and do some very unique things, in the home environment or in long-term care facilities in order to make sure that those complex care needs are met. So definitely with compassionate care, we have a very unique capability to provide specialized care specifically for cardiac and pulmonary patients that are facing progressive and very complex diagnoses in those two areas. The programs are called Cardiac Connections and Pulmonary Connections. And they're actually programs that we have implemented here in the past few years. Our cardiac program especially is at this point very well developed. And our Pulmonary Connections program is developing very quickly. And what these programs basically do is they allow us to really provide intense symptom management for patients who are in a situation where their condition can change very rapidly at home or wherever they might be. So our cardiac patients, basically when they enroll with our hospice and enroll with Cardiac Connections, they have immediate access to cardiologists that we basically employ. These aren't people that we contract with. We have, we retain cardiologist practitioners, with our team. And so these folks will actually come and visit patients in their home. Our cardiac and pulmonary patients receive daily phone calls, basically to assess on the quality of sleep that they're receiving at home. When you think about cardiac disease, and especially just the very drastic fluid fluctuations that occur with the patient, and the fact that they can retain fluid and require pretty quick intervention in order to be able to respond to that. Our daily phone calls and kind of our increased frequency of visitations for those patients really is very instrumental in helping to really keep them comfortable at home. We've found that especially with our Cardiac Connections program, but also with the Pulmonary Connections, we've been able to significantly reduce the amount of patient readmissions into the hospital as well. So, we've been able to reduce patient readmissions to something like 2%, 2 or 3% of the patients that are referred to us and enrolled in these programs. So that's one of the things that, when you think about what hospice does, and especially in this area, there's lots and lots of overlap. Hospice, we do a lot of the same things, but that's one of the things that kind of sets us apart is the fact that we do have these two programs that are really designed, to be able to provide that specialized care to patients that have end-stage cardiac and pulmonary disease.